Good evening to all the participants here. Very good evening. So, thank you for joining us today. I can understand your interest in learning something from psychology. So, it really keeps me going on and it keeps Chanakya going on because we can see students being very interested to learn whenever something new is presented or whenever something of their interest is presented. We can see the push, we can see the motivation from your end, and that keeps us going on. So, thanks for all the participants here today. And to introduce myself, I'm Mohammed Adil. I've qualified UGC NET and I'm fit to be an assistant professor. So, currently working in an institute in Coimbatore as an assistant professor in the Department of Psychology. I've graduated from Jain University, Bangalore. I'm specialized in counseling psychology, and I've been a freelancing counselor. And ever since Chanakya was incepted, I've been a part of Chanakya. We have conducted quite a number of workshops for now and internship programs as well. So that's the journey so far. Good evening to all of you who are responding in the chat box. So without further delay, I think we shall push to the topic for today. So we'll be talking about, discussing about problem-solving approach to family therapy, right? Particularly to family therapy. Hope the screen is visible to all of you. So, there are multiple therapy approaches when it comes to family therapy. It is indeed a bigger part of the ocean. Counseling is a bigger ocean, and family therapy is one huge chunk, right? And within family therapy, there are multiple approaches. You have Bowen's approach, you have solution-focused approach to family therapy, you have strategic approach to family therapy, then you have problem solving, you have narrative experiential family therapy, feminist approach to family therapy. There are a lot. So today we're just going to have a glimpse of how problem-solving approach to family therapy works. So if you've had a chance to check the poster, we would talk about the background of the therapeutic approach, then how a healthy family develops as per the theory, and how do problems develop, right, in a family, like what are the unhealthy patterns that goes on, and how does therapist can get involved and help them resolve the issues in a family. So the idea of problem solving approach to family therapy was proposed by J. Haley. He was born in 1923, and he is one of the phenomenal psychologists. He is one of the most influential and the one who contributed a lot in Mental Research Institute, Palo Alto, California. Right? So MRI has been the house of therapies where a lot of approaches were born in MRI because it is filled with a lot of great minds. You have phenomenal people who have worked there in MRI Institute, and J. Haley is one among. And he believes in his approach, in his vision. He thinks people do not develop problems by their own, right? Because if you even look at it from an hedonistic perspective, hedonistic motive to living, we always want pleasure. So we never create problems by ourselves. But most of the problems are created because of our response to the social environment we are in, right? We are interdependent beings. We live in line with the society, right? Whether we like it or not, we are supposed to go in line, in tune with the systems of the society. So being in a social environment, there will be a lot of interactions, and problems are created due to our response to those social environment and events in the social environment, right? So a therapist here would directly jump into the problem, right? he would directly approach each problem with techniques specific to the situation. So, in problem solving approach, there is no one size fits all approach. We are very much peculiar, very specific to the problem. So, say there is a problem in the family, we directly approach it, prioritize the problem, find a goal to it, make an action plan to implement the goal, see its effectiveness, and then we check out. So, it is purely customized, tailor made to those problems. So, it is specific to the situation. Right? So, he was a communication analyst, basically. Right? And his approach can also be called interpersonal because with this theoretical orientation, you would have understood how he says issues are because of social interactions, right? Because of social environment. So he always brings that interpersonal aspect into account, right? So here in the theoretical foundation aspect, he looks at how a therapist can induce a patient to change in the context of the therapeutic relationship. So the interpersonal aspect mentioned here also accounts to the therapist, right? We are also a part of the interpersonal aspect of our client, right? So Jay Haley wanted to come up with an efficient and economic approach to emotional problems, right? He didn't want to go on and on and on problems, right? He didn't want to spend a lot of time and energy, spend a lot of effort in resolving emotional problems. He wanted an efficient way. So you have to understand three broad terms here: effectiveness, and then there is efficiency, and there is efficacy. All right. So effectiveness is the impact, the level of impact created. How the role of one aspect has created an impact. The extent of impact is effectiveness. Efficiency is trying to create that impact with minimal resources, right? So say other forms of therapy are effective, but problem solving approach is efficient because it is able to bring the same result with minimal resources. That is how it stands out to be an efficient one, right? And efficacy as a term, if you look at it, it is the consistency in effectiveness. So it shouldn't be just for the phase in which therapy happens and then over time the effect fades out, then there is no point in doing a therapy session, right? So the idea here is coming up with an efficient and economical approach which will be standing and giving its effect for a while, efficacy to be precise. So problem solving approach and strategic approach to therapy are almost similar in terms of approach, like very close to each other. It talks about communication patterns, it talks about paradoxical interventions, but Jay Haley wants to stand out from strategic therapy because he says therapy can be called strategic if the clinician initiates what happens during therapy and designs a particular approach for each problem. Can we say that we take 100% control of what happens during therapy? No, that is a question. Can we take 100% control of what happens? Probably no. No, the client would initiate certain things, the situation would initiate certain things, and you would initiate few aspects. The environment would initiate certain aspects. So we can't say we take 100% control of the environment and we plan things up particularly. Right? We have to go with the flow. So that is how it differs from strategic approach, I would say. So coming to normal family development. According to Jay Haley, how does a family develop to be healthy? Right? How does a healthy family function? So he believed that there are natural hierarchies in families. Right? There is a clear hierarchy, and if someone crosses all those in the proper way, if the hierarchy is followed in the right way, it is believed to be in a normal family development. If any one member in the family tries to bypass the hierarchy, right, cross the hierarchy, then there will be problems, symptomatic behavior in the family. So the hierarchy is nothing but the generational hierarchy. No, parent, grandparents, parents, children, the generational hierarchy. So in a healthy family, to assume, let us say, there's a child, which is born, which is brought into the family. Initially, the child will be dependent on its family members, say particularly parents, right? It will be heavily dependent, quite dependent on them. Slowly, the child will start to gain autonomy, right, over the years, and it will start to gain competence. It will gain its own. It will develop. The child will develop its own personal identity, right? So as the child grows, like from childhood to a teenager to an early adulthood, we will see progression in an individual's development in terms of their autonomy levels, in terms of their competence, their clarity in identity. So with age, all these develops. So at a point, the child becomes equal, almost it gets elevated to a point where more or less equal in relation to its parents. When that is reached, when you reach that particular point, the child would start to whether of like leave from the family to form his or her own family, right? So that then the next chain of hierarchy starts. So now the child will become a parent, then the child grows and generation 2 goes on. So this is a normal family development. So what should a child know in order to be healthy psychologically or in a holistic perspective? In order to be healthy, a child should know how to operate in both complementary and symmetrical relationships, right? So the aspect of symmetrical and complementary relationship is a product of MRI. All right, it's a product of MRI. So if a child is able to operate in both these relationships, like complementary and symmetrical, learns to communicate clearly, right? Able to enter new relationships, exit whenever needed, be in a relationship, carry out as appropriate, then the child will be healthy. So that might lead you to a question: what is symmetrical and what is complementary? Right? It is natural to reach that question. So let us consider a healthy symmetrical relationship. Right? In a healthy symmetrical relationship, two individuals would start mirroring each other, right? So how it goes is like one person's success gets celebrated, it will be respected, it will be admired, right? So the other person in the relationship will respect you, will admire you, will celebrate with you, and will work to be equally successful, right? So the other person in the relationship will also work to get that success, basically mirroring you. So they will also want to be celebrated, respected, and admired for their success, and so forth. So one person does something, it is accepted, acknowledged, appreciated, right? The other person would also try to mirror it so that they also receive the same kind of appreciation, respect, and all of this. So this is a healthy symmetrical relationship. An unhealthy example of symmetry would be two siblings who are extremely competitive with each other, right? They are extremely competitive. Say one sibling gets second rank and is well appreciated by parents and family members. The other sibling would make the best efforts to go reach their first rank, right? Because symmetrical. he got all those success and appreciation, I should also get it. I also have to mirror it, right? So the person on top cannot enjoy because they are very anxious that they might have a competition, they might have a close call with the other person. So the other person have to spend a lot of energy to reach that position. So it is almost a tough fight between both the individuals in the relationship as to show who is better, right? Who does it better. So that is a symmetrical relationship. It can be held positively, it can also go negative. So complementary relationship. So in complementary, one person's behavior or whatever happens in their life fits into, complements the other, right? So one person's behavior complements another person's behavior in the relationship, right? Almost like division of labor. One person starts a new project, okay, one person starts a new activity, and the other person supports them in the entire activity to make it more successful, right? So one person starts, one person tries, and the other person is supportive of it, pushes it, gives all the moral and physical support whenever you, right? So they are very well informed about each other's contribution. They recognize and appreciate each other's contribution to the project, right? The most common form is an unhealthy complementary relationship, easily found in couples where one person dominates, disrespects, and controls the other, right? And the other person responds by becoming more and more passive to the. So one person dominates, another person becomes submissive and passive. It is also a complementary relationship, but is it healthy? No, right? So in certain aspects of life, you will have to travel between symmetrical relationships. In certain aspects, you will have to travel between complementary relationships. So, right? So, if the child learns to manage how to be in complementary situations, how to be in symmetrical situations, how to communicate in both the situation, then the child will be very healthy. All right, that is how a child can be more healthy. So, in a healthy family, within normal families, individuals are able to communicate their wants and desires, right? They'll be able to open up about what they want, open up about what they desire, right? So they make more self disclosure statements. They don't have to hide anything from the family, right? Open statements, disclosing statements, self disclosures are very comfortable to do. So when you repeatedly talk about what you need, you repeatedly talk about what you want in life, and you are very open about it. Eventually, your family will be able to accurately know about you, right? Say as simple as going to an ice cream shop, right? You visit an ice cream shop, you say that you want to have chocolate, right? Chocolate flavored ice cream. Chalo. So you're more open about what you want, right? So when you are comfortable doing it, in the longer run, your family would know that whenever they are planning to buy ice creams, they would know they should buy chocolate flavored ice creams for you. Imagine, no, you are not able to communicate your wants and desires. You are very hesitant to do self disclosure. Your family will not know what is the best thing for you or what is something that you like. Okay? So if it has to be a healthy family, there has to be a lot of open communication. Right? Open up without the fear of being judged. That is the aspect of a healthy family. So where does problems come in? Right? So we have discussed about how a healthy family can develop. Then what causes family dysfunctionality? So when a child does not learn to operate in symmetrical and complementary relationships, then problems do emerge within the families. When they get into the unhealthy part of symmetrical or unhealthy part of complementary relationships, it starts to be a problem, right? Imagine being the passive one in the complementary relationship. Imagine being the extremely competitive one, the extremely anxious one in the symmetrical relationship. It is not healthy in the longer run, right? Definitely not healthy in the longer run. So that is how problems start. If parents do not teach you to comfortably handle symmetrical and complementary relationships, then problems are going to emerge within the families. So one of the greatest contributions of J. Haley is this double bind theory of schizophrenia. We call it schizophrenic relationship. Right? Schizophrenic relationship, which is a result of double bind theory. So, double bind is an psychological impact created when contradictory demands are made of an individual. Right? It could be on a child, it could be on an employee, whoever it is, it doesn't matter. But when they are supposed to handle, when certain contradictory demands are made on the individual, it is an impact that's created. So no matter which one they follow, they will end up to be wrong. Say contradictory means two completely different approaches. So approach A is in north direction, approach B is in south direction. Wherever they go, one person is going to say that you are in the wrong direction, right? So you know you are in the middle of somewhere and you're lost. You ask for directions. There are two people there, right? Person A says go towards north. Person B says go towards south. Completely contradictory information. So which one would you follow? Despite choosing any one, no matter which direction you choose, it will be looked as an incorrect response. If you choose to go north, the person who said south will be like you're going in the wrong direction. So what happens? You do not know which one is right, which one is wrong. You don't know which one to prioritize. You will be completely in a state of confusion, which on the longer run puts you in a very uncomfortable situation called double bind. Right? So in a family, the child will receive two completely contradictory information from its parents. Say, for example, the mom, while feeding breakfast, while serving breakfast to the child, like or over a very casual conversation, the mom tells the son that no matter what the situation is, you should never lie. You should never lie to anyone. No matter how difficult the situation is, always say what is true. Always be honest. It's like, okay, mommy. Uh, Father is supposed to drop son in school. And happens due to some reason they go reach school a little late. The fault is on them, right? But when they reach the school and the watchman is no, why are you late? The right, the father immediately tells the watchman that there is a heavy traffic jam. An ambulance got stuck in the traffic jam, so we were clearing it up, and that is why we were late today. I was like, oh, okay, then fine, you can go in. But it was contradictory for the child because his mom told you should never lie. no matter the situation, you should never lie. But father clearly, it's a white lie. So in the evening, the child is asking his father, Dad, why did you lie? So the father tells the little boy, like, if the situation demands, and if lying will not lead you to any problem, then it is okay to lie, son. Imagine the situation from a 5-year-old, 6-year-old boy. Okay? Imagine how it would look for such a young person. So it is just in the morning, his mom told you should never lie. He took it seriously. He was like, okay. And then his dad, in the very same day, lies about why he is late to school and gives a different perspective to it. Now, there are two contradictory information, right? Completely opposite, contradictory information. So there are two realities that are presented here. So which reality should I follow? So when he is following one reality, the other becomes fake, right? So this is how, in the longer run, when this continues, when contradictory information continues, this is how someone can end up in schizophrenia due to certain schizophrenic relationships, like because of these double bind communication. The sad reality is that the child cannot talk about the contradiction to both the messengers, because the child does not know that it can talk about it. It's a very young child, right? So it cannot tell its dad that mom said so, you should never lie, or it cannot tell his mom that dad says it's okay to lie. It cannot talk. It cannot interact with both the messengers who is giving that message to the child. So the victim here, according to double bind theory, the victim who becomes psychotically unwell is in a communication matrix, right? Where the messages contradict each other, and he or she is not able to communicate, right, that contradiction, and he or she is not able to leave the interaction, also not able to leave the situation as well, because it is his or her parents or close relatives. So imagine being in that double bind situation all the time. Which will you take as a reality? Which will you follow? Which will you internalize? So this is how problems are created because of social environment, right? So when you receive two messages everywhere, when you receive contradicting messages everywhere, then you will start thinking that every statement there is a lie underneath, right? There is an underneath concealed meaning there. There is a hidden meaning in every message. So you will start doubting everything, right? So is it right or is it right? Which one should I follow? A or B? So the confusion that comes in, you'll end up being labeled as paranoid, right? A suspicious person. So you will find that every message is confusing, every message is unimportant, every message is a silly message. You ignore all the messages and you end up being in a state of schizophrenia. So the process of therapy now to problem solving approach. What do we do really here? We have to first of all identify solvable problems in the family, right? We have to identify what is the solvable problem in the family and then prioritize, right? Let us say there are A, B, and C, three problems in the family that are solvable, but you have to prioritize and give an order which one should be resolved first, which one should be set later, things like that. And then you set goals. You have to set smarter goals, specific, measurable, attainable, realistic, time bound, You have to evaluate them on time and review the process. So you directly focus on what is the solvable problem here. You set goals to solve it, right? You actually set goals to make a vision, what has to be done here. And based on the goals that you have, we can plan systematic, customized interventions. We understand the problems of the family, we prioritize them, we set goals for the family. Based on our goals, we can design interventions to achieve the goals. Once you design interventions, implement them, right? Implement the interventions, right? And evaluate them. So you introduce an intervention, look out for the responses, right? So is it positive, is it negative? And based on the responses, tweak your intervention accordingly. And then ultimately we'll examine whether the outcome of therapy to see, it has been effective. So it is purely tailor-made interventions based on the problems that are faced in the family, right? There is no one size fits all. There is no system approach that we will follow the same set of steps with everybody. No, we find the problem, prioritize, set goals, then make interventions, custom made interventions to reach the goals, implement them, find its effectiveness, evaluate them. If there is any need, change, alter, and then finally see that you give a good end product, right? So you must be sensitive and responsive to the patient, their social situation, and we have to plan things based on the individual and their social situation. But how he or she proceeds will be decided by themselves, right? The progress, the rate of progress, the direction of progress, everything will be determined by the client themselves. We just show them the direction, right? We just initiate, facilitate the direction. We are just a catalyst here in the reaction. All right. So when you look at families with problems, there is a greater discrepancy in these two concepts, two measures. How many items are rejected and how many items are expected to be rejected, right? Say you have certain ideas in mind. How many items, when you share those ideas, say you share 3 ideas, how many are rejected, right? And you have 3 ideas in mind, and how many do you think, how many do you expect that it will be rejected, right? So there will be a greater discrepancy. You will think that okay, if I ask for 5 items, right, if there are 5 items, only one will be rejected. That is your perception, right? I make a list of 5 desires, I make a list of 5 options, and when I give them, I expect that one could be problematic, but the other 4 will be accepted. But in reality, in the 5 options that I presented, 3 were knocked down or 4 are knocked down. So, you thought one would be knocked down, you expected one to go down, but 3 or 4 were knocked down. So there is a bigger discrepancy in what you expect and what happens, because there is no clear communication, no clear understanding within the family. So choice fulfillment is the index of individual choices that becomes family choices. If you wish for something and your family approves it, that becomes choice fulfillment. So your choice, your wish, your aspiration also becomes your family's choice and wish. So You think in line with your family, think in line with the value system of the family. So whenever you propose something, that goes hand in hand with the family, and your choices are fulfilled. So if the choice fulfillment is higher, then it will be a healthy family. The interactions, the operations within the family will be healthy, and it is going to be a smooth and healthy family. But when there is a huge discrepancy, when the choice fulfillment index is very low, then it is abnormal. Right? It is completely abnormal and unhealthy practice. So Jay Haley wanted to understand why family is there, right? And what the problems. He just wanted to find out the answers to these two questions. Why do we have a family? What is the purpose of a family? And why does it create problems in life? Right? He just wanted to find answers to these two questions. So, whenever you present a problem to Haley, right? So you say, here's a problem, he will take it as a problem, right? You say that this person spends a lot of time reading books. Okay, my husband does not interact with me at all. Rather, he spends a lot of time in reading books. He reads a lot of novel. He gets into the novel. He gets lost in the world of novels, and he does not spend time with me at all. Right? So Haley will be like, okay, oh, that is a problem. Right? He will take the problem as it is presented and silently restructure in terms of what is happening. Right? Silently restructure, present it in a different format for you to understand why he is reading a lot, why he is lost into the world of novel, what is making him to do so. Right? The role of social environment in our behavior. So when the wife is complaining about the husband reading a lot and not spending time with him, Haley would restructure it, present it in a completely different perspective for the wife to understand why he's doing it. Right? So here you don't find a lot of emphasis on the past history. No. It is purely phenomenological, present mode. Okay? So it is very much an action-oriented approach. When someone follows problem-solving approach, it is very much active, very much direct, and action-oriented. So we will not choose sides of the family. Like I am in favor of this side or I am in favor of that side. No, very neutral approach to therapy. That is how we are supposed to be. And seeing the directiveness, it is an extremely directive approach, no? And problem-oriented approach. People come with problems to you. You understand the problem, set goals, do interventions, resolve it, and leave. You don't want to understand the history, you don't want to understand the family, nothing. Understand the problem. If someone is presenting you the problem, understand as it is, take it as it is, then restructure it, bring the resolution, and check out. So he does not wait until the client gets an insight about solutions, right? Not interested in helping the client develop an insight and they themselves come up with solutions. No, because they are looking out for an economical and efficient one. So it has to happen with minimal resources, quick, faster, effective. So instead of going on with sessions and sessions, let me put it very straight and direct so that you land up where you want to land. Right? The treatment focus of treatment is change in behavior. When the unhealthy patterns change to be healthy patterns, problem is solved. All right, problem is solved. So if we look at the evaluation, it is not a standalone approach. You cannot, in modern days, or at least in practice, we choose to be eclectic. So we cannot solely base our approach on problem solving, right? Because there are a lot of aspects that are ignored, like say insight, learning, and you coming up with solutions, non-directiveness. It is all absent. And in the aspect of intervention, sometimes we'll use paradoxical interventions, no, prescribing the problem itself to them. So that will be under a different approach. Like say, a strategic approach to family therapy also uses paradoxical interventions. So problem solving approach does not have a unique set of interventions by its own. It borrows multiple interventions from different approaches, different logics, right? And it is directive, completely directive, and that is a problem. We don't give scope for the family to come with resolutions, come with skills, right? It is a very directive approach. And like the focus is only on change. We want action, we want to solve the problem, nothing else. And even the double bind approach to schizophrenia, it's not complete. You can't say 100% this is the reason why. So it is a theory, it is a set of ideas, it is a set of assumptions, but not complete as such. You can take parts of it. Say when you want efficient outputs, when you want to be economical and efficient in the therapy, when you don't have much of time in taking the case history, understanding the problem, understanding the dynamics within the family, when you cannot spend a lot of time, you cut short all those, directly jump to problems, start working on them, see changes in the family, and check out. So in those scenarios, problem solving approach would work. And I think I answered Anshul Chopra's question. What are these interventions like? He did not specify any interventions particularly, because it is custom made. It is particular to the problem. So it is going to be from the psychologists, like the counselors, what will fit into the picture, what will be the right resolution to the problem. We can experiment that. Right? So we can borrow it from other theoretical orientations. So this does not have a particular set of interventions as such. So yeah, that is it from my end. Just a brief and quick introduction to problem solving approach, because FMT has multiple approaches. Like I started, has multiple approaches, and this is one among them, right, by J. Haley. So if there are any comments, questions, queries, anything, then feel free to access the chat box. I'll try to answer them to the best of my knowledge. You're welcome, Anshul. So the comment section is open to the participants. If there is anything, feel free to. All right. So I would say any book on family and marital therapy would definitely cover problem solving approach. Like you need not go in particular to understand Haley's approach. Any book, say on family therapy, it will definitely cover MRI's contribution. It will definitely cover system theory. It will definitely cover communication theory, and it will also have problem solving approach. So needn't go just for Haley. Like any family therapy book, famous one is by Michael. So if you go by that, you will definitely have data, for additional reading. Michael Collins, I would suggest. Thank you so much for all your comments. Gratitude. For intergenerational trauma, you can go with the traditional approach of Bowen. Bowen's approach in itself is multi-generational. It will be an extensive approach to therapy, the traditional one, but it definitely has what you're looking forward for. Because the idea in itself is multi-generational approach to family therapy. So you will definitely find the solution there. Thank you. So the ones who are asking for the name of the book that I can suggest, I would say Family Therapy: Concepts and Methods by Michael Nichols and Sean Davis. Michael Nichols and Sean Davis. Family Therapy: Concepts and Methods. All right. So thank you for patiently listening to the webinar, and I hope you have got some takeaways, got some idea, or at least an overview of how problem-solving approach works. So Chanakya, we do handle a lot of webinars, so we are expecting your support, and we are also handling internship programs in counseling psychology, clinical psychology, and based on request, we also handle school psychology and industrial psychology. So for internships, for more practical exposure, you can reach out to us. I will be facilitating the clinical counseling internship. So it's a 1-month program. If you are interested, we are open for the month of October. So you can reach out to Chanakya Mental Health. Thank you. Does Charlie's approach can be adopted? Yes, it can be. Say most of us have an eclectic approach. So if you want to take parts of Halley's approach into your therapy, yes. As I mentioned, when you want to be effective and economical in terms of time and energy, you can have an part. You can adopt it into real-time practice. You can make it eclectic. So if there aren't further questions, we sign off. Thank you so much for the support. Have a good day, people. Good night.